Hi, I'm Dr. Christopher Hess. We're here at Hess Plastic Surgery in Fairfax, Virginia to talk about CoolSculpting by Zeltiq. CoolSculpting is a non-invasive, revolutionary way of fat reduction. We're here today to demonstrate how this procedure is performed. So at this point, we've met with our patient in consultation and we've determined that she's a good candidate for CoolSculpting. One of the first things we have to do is determine which applicator we're going to use. And we have these templates that will help us determine which applicator, whether it's a small one or a large one, we're going to use. This is our patient Shelley, who's agreed to help us out today. Our next step is to get a pre-procedure measurement of the area we're going to treat. I'm just simply going to pinch the area and use my caliper here to get a good measurement. Once we have that measurement, we'll write that down, and when she comes back to visit us in a few months, we can compare what our pre-procedure measurement is to her post-procedure. So our next step is to determine where we want the applicator to actually sit on the patient. So I'm going to take my template and place it right in the middle of where I want that applicator to sit. I'm going to mark the midline and then each end. Now our patient will get on the table. We've got several pillows under her to make her quite comfortable. So our next step is to apply the gel pad to our patient. So Shelley, this is a pad that contains ultrasound gel. We're just going to open the package here. And this will be nice and warm. We're just going to apply it to her abdomen. We want to make sure we get rid of all of the wrinkles and the air pockets. Are you comfortable?
Yes.
Good. So the next stage is to apply the applicator to the patient. So Shelley, we're going to apply this to you, and you're going to feel a suction or a pull as the tissues get pulled up into the device. We've set the machine to the appropriate settings. We've turned the suction on, and that suction in the device head is going to allow the skin and the fat underneath it to get pulled up inside, in between the cooling plates, which is what's going to do the work for us. So we're going to place the applicator on, turn on the suction, and then turn on the cooling itself. We have 4 different applicators. We have the large 8.0, and this is really designed for the abdomen, either upper abdomen or lower abdomen. We have 2 curved devices, the 6.2 and 6.3, and these we use either for flanks or inner thighs. And then we have the CoolFit applicator, which is a flat applicator that's really great for either inner thighs or upper arms. The device is going to cool the tissue down to in the area of 40 degrees. And when it does that, the fat cells are going to crystallize, and when they crystallize, they start to fall apart. Your body's immune system then comes in, cleans out these fat cells. CoolSculpting is not just for abdomen. We do the waist on the sides and towards the back. We also do the inner thighs and the posterior upper arms. So it's been an hour. We will now take the applicator off, so I shut off the suction, and I'll gently lift it off of the tissue. And as you can see, the tissue is firm and kind of in the shape of a stick of butter. We're going to remove the gel pad, and we're going to gently massage this tissue down, and this helps mechanically break up some of the fat as well. So we do this for about a minute. Afterwards, she can expect a few days of different sensations such as itching, burning. In addition, the area that we've treated will be numb for approximately 3 to 4 weeks, after which time the sensation will return. Follow-up for the patient involves an appointment at the 2-month mark, at which time the result is approximately 80% there. And at that time, patients often decide whether they'd like to choose to do another treatment or not. Thank you for joining us today. Remember, CoolSculpting is not a weight loss technique. It's a method to address stubborn fat. Please call our office today to schedule your consultation.